Hello again. Welcome to my channel, Clear Path Wellness. My name is Joshua, the patient advocate. Today we are going to discuss arthritis. So basically, understanding arthritis in Kenya's healthcare system. So in that regard, these are the aspects that we are going to cover today. So the following areas are very necessary that we tackle as we discuss arthritis. So, 1 is what causes arthritis. We'll discuss the causes of arthritis. What are the signs and symptoms of arthritis? Then 3, what are the types of arthritis? Then 4, how do we diagnose arthritis? Then 5, what tests can be done to identify patients with arthritis? So, to start, ready? What is arthritis? So, arthritis refers to inflammation of one or more joints. So, you find that it is not a single disease entity, but rather a broad category of ailments that affect the joint. To mean that there are many types of arthritis, by the way. So we've said that arthritis is inflammation of the joint. So what is inflammation? So inflammation refers to autoimmune hyperactivity to neutralize foreign substances, for example bacteria, or even the body's mechanism to repair dead tissues, as commonly seen in arthritis as well. So in context, since arthritis is an inflammatory condition, these are the symptoms that we would expect on the joint. The first, you find that patients complain of joint pain, also joint stiffness, joint swelling, and these often worsen with age. And these symptoms are very suggestive of inflammation. So also we have different forms of arthritis, but generally they result to wear and tear of the cushioning cartilage or the soft tissue that prevents the bones from actually eroding each other at the point of the joint. So what causes arthritis? So the causes of arthritis are many. There are different forms of arthritis, and based on our healthcare system, the 2 most common forms of arthritis in Kenya include osteoarthritis and rheumatoid arthritis. So osteoarthritis. Osteoarthritis is caused by physical wear and tear to the joint that usually worsen with weakened tissue of the joint due to age, strenuous activity, or even engaging in strenuous exercise or strenuous movement. Whereas rheumatoid arthritis, on the other hand, is an autoimmune disorder that usually involves the body's immune system attacking the lining of the joint. So you find that other factors also contribute to development of arthritis, and these factors include, to enumerate, injuries. For instance, maybe surgical injury, that is, falls from a high place. Obesity also is a major contributing factor, and also maybe when you put too much stress on one part of the body, that is poor alignment of weight on the body, you can be susceptible to arthritis on that basis. So also we have genetic vulnerability. So you find that some individuals are genetically vulnerable to arthritis. Also other environmental factors like smoking, exposure to certain toxic substances like asbestos can actually trigger occurrence of arthritis. Also, it has been identified that industrially processed sugars can really trigger the occurrence of arthritis. Also, weather changes. Some patients report severity of arthritis when it is hot. The weather being hot can actually exacerbate inflammation. So that is the concept. These patients, which symptoms do they usually present with? When these patients come to your clinic, they present with symptoms of swelling, redness of the joint, also decreased ability of movement. So these symptoms typically suggest inflammation of the joint, and sometimes they get worse during the morning or after a period of inactivity, because in some cases arthritis patients might need to move so that that fluid that cushions the joint is generated. So you find that in the morning before they engage in movement, arthritis is usually worse. So what are the types of arthritis? The two most common types of arthritis in the Kenyan healthcare system, as we've already indicated, are rheumatoid arthritis and osteoarthritis. So for osteoarthritis, as we already said, it is the mechanical wear and tear of the joint, whereas rheumatoid arthritis involves immune wear and tear of the joint. So in concept, how can we distinguish mechanical to immune causes of arthritis? We'll need to do tests. And one common test is usually the laboratory test to identify what we call the rheumatoid factor. So in principle, when we identify this factor, then it can indicate that the patient is suffering from rheumatoid arthritis. Other forms of investigations usually include taking a thorough history of symptoms, knowing the patient's diet, and also knowing the occupation of the patient, and also you need to assess them physically on the joint to identify warmth, redness, or even inability of the joint to move. So on the assessment, you really need to pay attention to the patient's experience of pain with movement. So it is also important to note that determining the specific type of arthritis is critical, because you know what? Treatment of arthritis of immune type is different to that of erosive type. So let us agree on that. So the specific tests that can be done for rheumatoid arthritis include: one, identification of the rheumatoid factor, and that is very, very significant. Let us take that point. So for these other forms of arthritis, typically to identify erosion, we can do x-rays. So whether the erosion has been caused by rheumatoid arthritis or osteoarthritis, x-rays can help in such cases. Whereas ultrasounds and MRIs are very significant in that they give detailed imaging of the wear and tear on the joint, and even including the surrounding tissues. So in that aspect, they can be very important to identify if the arthritis has also led to wear and tear of the surrounding tissues, maybe the tendons, the cartilage that hold the joint together. So that is all I had for you today. So maybe to review what we've discussed, we can indicate that arthritis encompasses more than 100 different conditions, but typically they manifest with joint inflammation. And osteoarthritis and rheumatoid arthritis are the most prevalent forms of arthritis. So I'll do a video on management of arthritic conditions.